Okay, so let's, I hear that cappuccino machine. Far be it from me to compete with a good cup of cappuccino. Okay, so again, just remember, we left with this thing, okay? Oxidative stress, toxins, inflammation. So the inflammation, remember I said, is seen in the brain in these kids. This was reported I can't believe it was 5 years ago now, from Johns Hopkins in a very renowned medical center in the States, the Annals of Neurology. This is biopsies from 11 children that died with autism from injury or accident, and many of them were drowning. So you have to be very careful when you have an autistic child that if you have a pool or access to a pool, that drowning is something that can happen. So you have to be very careful about that. But what they showed in that study was all this inflammation in their brains. And this was what we call a landmark article. It talked about inflammation, neuroinflammation, and neuroglial activation. In the brain, there are neurons, those are your brain cells, and also companion cells, glial cells, astrocytes. Microglia are the immune cells of the brain. And what happens is these microglia are activated. And when they're activated, they're secreting all kinds of inflammatory messenger molecules, causing all this inflammation. And when this was reported, this really catapulted us in our approach to the kids and our treatment of the kids, because it told us we have to deal with this neuroinflammation. So in the last 5 years, we've had an exponential increase in our ability to help the kids because we've been conscious of this neuroinflammation. And when we talk about treatments, there are various things that can help quiet neuroinflammation. And that has been very helpful. Okay? And then also the oxidative stress. You see this on the cellular level. Okay? So really, in a lot of ways, these kids have a brain on fire. This is a neuron on fire. And in a lot of ways, and I usually say this when I speak, don't some of the kids look like their brain's on fire? And then we have to put it out. And that's part of our job, is to quiet that fire. But the inflammation is not only in their brains, in the nervous system, it's in the immune system, it's in the GI tract, esophagitis. When we put an itis, when it's inflamed, the esophagus is inflamed, the colon is inflamed, the skin is inflamed, eczema, atopic dermatitis, and asthma, the bronchioles are inflamed. Asthma, when it was defined, when I was in medical school, I'm not going to tell you how long ago that was. It's probably longer than you think. Asthma was thought to be mostly a bronchospastic disorder. In other words, the bronchioles were in spasm and too much mucus. Then, a number of years later, it's been described that it's mainly an inflammatory disorder, still with some spasm, obviously. But it's the anti-inflammatory treatment of asthma has revolutionized the treatment of asthma. And so it probably would have been called asthmitis if it would have been known when it was first described. So these kids are inflamed in a lot of places. And look, this is with a scope from the pediatric GI, this is the esophagus. Look how red that is. That is painful. That hurts. So a child that has this inflammation might be going like, who can't speak, right? Can't tell you. So he or she, we'll say he just for generic, but it could be a she. Ah! Ah! Why? Because it's so painful. He's trying to get in any position that he can to be less painful. All right? This hurts. And when you treat this, lo and behold, what happens? Those behaviors can dissipate. Did you treat the autism with something that treated it? You actually treated the symptoms without giving any medicine for, quote, behavior, by treating the underlying medical problems. This is what we're trying to teach. The medical problems are so important. This is a colon. This is inflamed colon with ulcers. This can really hurt. And if a child can't tell you that, what do? Or, they bite themselves. Oh, they're autistic. They bite themselves, right? You treat this inflammation, what happens? They stop biting themselves. You have to be aware that some of these behaviors are related to pain, related to inflammation. Very important. This is the child with this on his scope. This is doesn't he look like he's from a third world country? He's not. Bloated belly, thin extremities, malabsorbing, inflamed. These are basically from Dr. Wakefield, these pictures. But basically, this is what we see in a lot of the kids. Very thin extremities, very bloated bellies. Their guts need to be examined. Their guts need to be treated. And this is a patient of mine from Switzerland, actually, who this is what he used to always do. Why? Because he's autistic, right? No, because he had so much pain in the belly, he tried to put pressure on it. And when you treated his inflammation and you treated what was going on in the gut, he stopped doing this. Okay? Just trying to drive home how important the GI tract and inflammation. So the consequences of this GI dysfunction are inflammation, alterations in transit time, i.e. constipation or diarrhea, malabsorption, so they get maldigestion, so you see undigested food in the stools, they're not absorbing the nutrients well, they get this leaky gut or altered intestinal permeability that allows things in that shouldn't. I don't have enough time to dwell on these things, but I have whole lectures on just the gut. But systemically, this is in the GI tract, but GI dysfunction can lead to systemic problems. Increased total load of toxins, immunologic dysregulation, because approximately 75%, 70 to 75% of your immune system is in the gut. And why is that? Because the immune system, remember, has to differentiate self from non-self. And how much stuff you shovel in to your gullets on a daily basis that has to be recognized by the immune system as foreign and dealt with, or self. So basically, it's a huge repository of immune cells. And so if there's problems in the gut, you can have immune dysregulation that's way beyond the gut. You get inflammation in the gut, but also that becomes systemic, and you get inflammation systemically, including in the brain. Okay, and then let's end with the immune, and then we'll go to ADHD and asthma pretty quickly. But this is just, I love this slide. This is from a friend and colleague of mine, Dr. Wajani, an immunologist, basically showing you, now I'm not going to speak a lot about the immune system. It's very complex. But this is just showing you that you need to have harmony in the immune system. There are different arms of the immune system. There's the T helper 1 arm that's involved with cell-mediated immunity, and there's the T helper 2 that's involved with these antibodies, or these immune proteins. And you need to have balance. And I'm going to show you why in a second. And the immune system, when we were in medical school, was a system that basically, the books changed every year. It was the most quickly evolving system. And although it's not quite as quick now as it was then, it's still amazingly evolving in terms of the knowledge of the immune system. And what these cells here, these Treg cells now, we didn't know about them years ago. This is one of the latest kids on the block. This is like the harmonic conductor that keeps this balance. Everything in the immune system is about balance. My first book I wrote in 1997 was called The Road to Immunity. I almost called it Immune Balance, because that's what it's about. You go to the health food store and you're going to have a high school kid tell you, you want to rev up your immune system, you want to boost your immune system. But if you have autoimmunity, you want to quiet your immune system. It's not always about revving it up. And these Tregs are like the conductors, and they try to create harmony. And what is very simple that enhances the Tregs so that it regulates the immune system function? Probiotics, the good intestinal bacteria, and vitamin D. Very simple. And what causes a reduction of these Tregs and an increase of this Th2, and it promotes this imbalance? BPA. You've heard of bisphenol A, BPA. It's in plastics. All right? It's out there. It's very problematic. It's estrogenic. It's very problematic. You do not microwave in plastic. Okay? And this is something I have to have 2 teenagers, right? Well, my daughter's going to be 21 and my son's 15. And to tell them you can't put plastic in the microwave because you get more leakage of these plasticides, which are very unhealthy. Teenagers, they think they're immortal. They could care less. You know how some of the foods are covered? They say cook it for a minute with the cover on it. Horrible. You want to put it in glass. You don't want to microwave in plastic. Okay? Especially for your, what do we used to do? Heat up the kids' bottles when they're in plastic bottles, right? And what we do, we heat them up in boiling water. That kind of heat increases the leakage of the plasticizers. And what happens is they promote this immune imbalance that might contribute to allergy and asthma, okay, by decreasing the Tregs and enhancing this Th2 skewing, so a skewed immune system, okay? This is complicated. This is just showing that there was articles saying it's Th1 skewed, articles saying it's Th2 skewed. Then a few years ago, this article came out showing that it's actually, both of them are actually activated Th2 predominance, but you didn't have the increase in the regulatory Tregs and the immune messenger of the Tregs IL-10. So the bottom line is you have too much inflammation. There's something called tumor necrosis factor alpha, TNF alpha. We're trying to decrease that in the kids because it's very inflammatory, and you don't have enough of the regulatory immune messenger molecule, IL-10. This is complicated, I don't expect you, but I want you to know that there's a lack of balance in the immune system in a lot of these kids. And this is just another one showing inflammation. This came out a year ago, just showing, this one was an increased Th1 pathway, suggesting localized brain inflammation and an autoimmune disorder may be involved in the pathogenesis of autism spectrum disorders. So again, immune dysregulation, autoimmunity, very important subset. And when I see kids, I try to figure out where they fit in, and the doctors who I teach will recognize that every kid does not get the same thing. It depends on where they fit and what is going on. Some kids are very, very prominent immune dysregulation and autoimmunity. Others might have very much gut. Others might have very much mineral deficiencies. Others might have on heavy metals, etc. And there's an overlap as well. So with the immune dysregulation, we see both deficiency and dysfunction of the cells. We see allergy and hypersensitivity, where the immune system is overreactive, but not to itself, but to things like pollens or foods. We see autoimmunity, where the immune system is actually reacting to itself. Remember, I showed the colon to the brain. And ultimately, we see a lot of inflammation. This is all the immune dysregulation we see in a lot of the kids. Very important to be aware of. Okay, and lastly, this is called Pandas, or pediatric autoimmune neuropsychiatric disorder associated with strep. This is basically a disorder where it's like we call it the rheumatic fever of the brain. Anybody ever heard of rheumatic fever? When you get a strep infection, you make antibodies to the strep, but unfortunately those antibodies can cross-react. They get confused, and they see a part of the heart muscle looks like strep, and they attack the heart muscle, and you get rheumatic fever. But there's also a part of the brain in the basal ganglia that also looks like the strep. Looks like it enough so the antibodies, rather than just going for the strep, actually react to a piece of the brain called the basal ganglia. What happens when you react to that part of the brain? You get obsessive compulsive disorder, you get tics, you can get increased anxiety, increased separation anxiety, increased rage episodes, increased ADHD. I've seen kids' writing get really bad. When these kind of things happen fairly dramatically, it makes one think, aha, maybe there's a strep infection going on with autoimmunity, and it's called Pandas. Oops, I don't know what happened here. Oh yeah, and then this is just the underlying features of chronic, and this just puts it together. You see here, oxidative stress, inflammation, and toxicity calling for detoxification, with glutathione being in the center. This is just kind of a nice model. This is, again, from my friend and colleague, Dr. Baker. Okay, let's go to ADHD and then asthma, and we'll go to treatment, okay? So basically, ADHD, again, not classically on the spectrum, but in terms of the approach. We're going to look at it on the spectrum from the approach point of view.